Eleanor is 74 years old. She lives in Grand Rapids, Michigan, in the same brick ranch house she has owned since 1989. And for 11 straight months, she woke up every single morning with a bitter metallic taste in her mouth, like she had been holding a penny under her tongue all night. She blamed her coffee, so she switched brands. She blamed her toothpaste, so she switched that too. The taste stayed. And because nobody ever explained to her what a persistent morning taste can actually mean after 60, Eleanor made one small, quiet decision at her kitchen table in March that put her in a hospital bed by October. If you are over 60 and you have woken up with a bitter or metallic taste more than a handful of mornings in a row, I need you to hear this, because that taste is not random, and it is almost never about your mouth alone. Reviews published in the pharmacy literature have documented hundreds of commonly prescribed medications that can alter your sense of taste, and I will name those reviews as we go. And if you take 3 or more daily prescriptions, the chance that at least one of them affects taste is real enough to check. In the next 25 minutes, I am going to walk you through the 4 medication categories most likely to cause that morning taste, with specific drug names. I am going to give you a 2-minute check you can do at your bathroom sink tomorrow morning that tells you whether the taste is coming from inside your mouth or from somewhere deeper in your body. I am going to show you the common morning habit that makes the taste worse, one that most seniors do every day believing it helps. And I am going to tell you about one cause of a morning metallic taste that has nothing to do with your mouth at all. A cause that may be the single most important early warning your body sends you in your 70s, and the one a rushed 15-minute appointment almost never has time to reach. I will get to that one later in this video, because the way Eleanor's doctors almost missed it is exactly the way it gets missed every day. Here is exactly what you are going to get in this video. First, the 4 medication categories most likely to cause a bitter or metallic taste when you wake, including 2 blood pressure medications by name and 1 diabetes medication that studies suggest affects roughly 3 in every 100 people who take it. Second, the 2-minute source check, done with nothing but a glass of water and your bathroom mirror, that tells you whether this is a mouth problem or a body problem. Third, the cause that has nothing to do with your mouth, and the one blood test question that catches it, sometimes years before other symptoms appear. Fourth, the morning habit that makes the taste worse, a habit sitting on the counter of most American bathrooms right now. And fifth, the exact words to say to your doctor and your pharmacist, including the one specific medical term that changes how seriously your complaint gets taken. And I will tell you now, one of the people you are about to meet had a taste that was the only warning his kidneys ever gave him. No pain, no swelling, nothing else. Just the taste. Hold that thought, because we are coming back to it. Before we go on, do me one small favor. Type your age in the comments below. And if you have ever woken up with this taste, say so. It helps me understand who is watching, and it helps other viewers see they are not alone in this. Now, about me. I have spent years working in medication safety education for older adults, and everything I am going to tell you today comes from published research and official sources, not opinion. I will name those sources as we go. And I want to be clear from the start, this video is educational. It is not medical advice, and it does not replace your own doctor who knows your history. What it will do is make sure you walk into your next appointment knowing exactly what to ask. So let me tell you what actually happened to Eleanor. Eleanor is a retired third-grade teacher. She taught for 31 years in the Grand Rapids public schools. She takes lisinopril for her blood pressure, and she has taken it without a problem for 6 years. In January of last year, her doctor added Metformin because her blood sugar numbers had crept into the diabetic range. The metallic taste started about 3 weeks later. Now here is the important part. Eleanor never connected the taste to the new pill because the pill went in at dinner and the taste showed up at 7 in the morning. In her mind, those were 2 separate events. So she chased the coffee and the toothpaste, and when those changes did nothing, she simply decided the taste was part of getting older, the same way her knees were part of getting older. And she stopped mentioning it to anyone. But a bitter mouth changes how you eat, whether you notice it or not. Eleanor started skipping breakfast because eggs tasted like tin foil. Then she started skipping the church coffee hour because she was embarrassed that everything she put in her mouth made her wince. By June, she had lost 9 pounds. By September, she had lost 14. She is 5'3", and she had gone from 141 pounds to 127 without trying. In older adults, that kind of unplanned weight loss is not cosmetic. Per the National Institute on Aging, unintentional weight loss after 65 is strongly linked to muscle loss, weakness, and falls. And on the morning of October 9th, Eleanor stood up from the edge of her bed, felt the room tilt, and went down onto her bathroom tile. She fractured her wrist in 2 places. She spent 4 days in the hospital and 6 weeks in a cast on her dominant hand, unable to drive, unable to open a jar, dependent on her daughter for groceries. And it was a hospital pharmacist, not a doctor, who finally asked the right question. He sat down with her medication list, heard the word metallic, and said, "How long after you started the metformin did this begin?" 11 months of misery, 14 pounds, and a fractured wrist, traced back in under 5 minutes to a known, documented, published side effect of one of the most commonly prescribed medications in America. Eleanor is a composite of real patterns. Her name is changed. But I want you to understand something. Nothing about her story is unusual. Surveys suggest that a large share of adults over 65, some estimates run as high as 2 in 5, report some measurable change in taste or smell. Most of them, like Eleanor, never mention it. And here is what nobody told her, and what I am going to spend the rest of this video telling you. The mechanism in plain English is this: that morning taste is almost always one of 3 things. Chemicals from your medications concentrating in your saliva overnight, a dry, unprotected mouth letting bacteria and old cells sit on your tongue for 8 hours. Or, less often but more seriously, your body signaling that something deeper in your stomach, your kidneys, or your blood is off. Let me take those one at a time, because once you understand the machinery, you will be able to reason about your own mornings the way that hospital pharmacist did. And keep Category 3 in mind as we go, because it is the one that saved a man named Raymond's life, and I will close the loop on it in a few minutes. Start with the medications. Many drugs, once absorbed into your bloodstream, are actually secreted back out in small amounts through your saliva glands. You swallow the pill at dinner, your blood level rises overnight, and by morning your saliva has been quietly bathing your taste buds in trace amounts of the drug for hours, right when saliva flow is at its lowest. That is why the taste peaks at waking and often fades by mid-morning after breakfast and fluids wash it away. This is documented across 4 big categories. 1. Blood pressure medications, especially the ACE inhibitor family. Captopril is the classic offender in the research because part of its chemical structure binds zinc, and zinc is essential to how your taste buds work. Lisinopril, Eleanor's drug, is gentler but still carries taste disturbance in its official prescribing information. 2. Metformin, which studies suggest produces a metallic taste in roughly 3% of the people who take it, usually in the first months. 3. Certain antibiotics. Metronidazole and clarithromycin are famous for it, and if you have ever taken either one, you may remember the taste vividly. 4. And this is the sneaky one. Anything with a drying effect, because it attacks the second mechanism. That second mechanism is your saliva itself. Saliva is not just water. It buffers acid, it washes away bacteria, and it carries dissolved food chemicals to your taste buds. Per the National Institute of Dental and Craniofacial Research, dry mouth becomes dramatically more common with age, not because of age itself, but because of medications. Water pills like hydrochlorothiazide, bladder medications like oxybutynin, older antidepressants like amitriptyline, and, pay attention to this one, over-the-counter sleep aids containing diphenhydramine, the ingredient in most products with PM on the label, all reduce saliva flow. Add 8 hours of sleeping with your mouth open, and you wake up with a tongue that has been sitting unrinsed all night. Bacteria break down proteins in your mouth overnight and produce sulfur compounds, and your brain reads that chemistry as bitter, sour, or metallic. And the third mechanism is the body signaling upward. Stomach acid or bile drifting up your esophagus while you lie flat can leave a bitter film in your throat by morning, even if you never feel classic heartburn. Doctors call that silent reflux. A vitamin B12 deficiency, which the National Institutes of Health notes, becomes harder to absorb from food as we age, can inflame the tongue and distort taste. Uncontrolled blood sugar can do it. And then there is the one I teased at the start, which I am still holding, because it deserves its own moment later in this video. Now look back at Eleanor with all of this in view. A drug known to cause metallic taste, added in January. A blood pressure pill from a family known to interfere with taste chemistry. Nighttime concentration, morning saliva at its lowest. Her mornings were not a mystery. They were machinery, working exactly as the prescribing information said it might. Let me show you how differently this same machinery plays out in 3 other people, because I want you to find yourself in one of them. Frank is 68. He lives outside Tucson, Arizona, retired from 26 years as a long-haul truck driver. Frank started metformin in April, and like Eleanor, he developed the morning metal taste. But Frank did something different. He mentioned it once at his July appointment, and he mentioned it wrong. He said, "Food tastes a little funny lately." His doctor, 13 minutes into a 15-minute slot, heard a vague comment and moved on. Here is what I want you to take from Frank. The words you choose determine the medicine you get. Funny taste gets a shrug. A specific report. I wake every morning with a metallic taste. It started 3 weeks after the new pill. It fades by 10 in the morning. That gets a medication review. When Frank finally said it that way, at his pharmacy of all places, the pharmacist called his doctor. The Metformin was switched to an extended-release version taken with his evening meal, and within a month, Frank's mornings were back to normal. Same drug class, same benefit for his blood sugar, different formulation, problem managed. He never had to choose between his sugar control and his breakfast. Dolores is 81. She lives in Charleston, South Carolina, and she has worn upper dentures for 9 years and used a steroid inhaler for her COPD for 4. Her morning taste was not metallic. It was bitter and stale, and it came with a white coating on her tongue that she assumed was normal. It was not normal. It was oral thrush, a yeast overgrowth, and the combination she had is one of the most common setups for it in people over 75. Inhaled steroids leave residue in the mouth that encourages yeast, and dentures worn overnight give that yeast a warm, dark surface to grow on. Dolores had stopped eating lunch with her 2 closest friends because she was ashamed of her breath and her mouth. 8 months of shrinking her life, and the fix was almost embarrassingly simple. Her doctor prescribed an antifungal rinse. Her dentist showed her how to clean and soak the dentures nightly instead of sleeping in them. And her pharmacist taught her to rinse her mouth with water after every use of the inhaler, which the inhaler's own printed instructions had said all along, in letters almost nobody over 80 can read. 6 weeks later, the taste was gone, and the lunches were back. Dolores is the case that proves the taste is sometimes exactly what it seems. A mouth problem with a mouth solution. And then there is Raymond. And Raymond is the reason I made this video. Raymond is 77, a retired machinist in Portland, Oregon. His mouth was fine. His dentist confirmed it. Healthy gums, no coating, good saliva. And yet every morning, a flat metallic taste, and lately, a faint smell on his own breath that his wife described as ammonia, like window cleaner. Raymond had been taking lisinopril for his blood pressure for a decade, and, this is the detail that matters, ibuprofen almost daily for his knee arthritis, bought over the counter, never on any medication list his doctor saw. Here is the loop I opened at the start of this video, closed. A persistent metallic taste with a clean, healthy mouth can be an early sign of declining kidney function. Per the National Kidney Foundation, when the kidneys filter less effectively, waste products like urea build up in the blood, and your saliva reflects your blood. Bacteria in the mouth break that urea down into ammonia, and you taste metal and smell window cleaner. And the combination Raymond was taking, an ACE inhibitor plus a daily anti-inflammatory like ibuprofen, is specifically flagged in the research as hard on aging kidneys, because each one reduces blood flow through the kidney's filters in a different way. Raymond's blood test showed his kidney function had slipped into what doctors call stage 3 chronic kidney disease. He had no pain, no swelling, no warning, except the taste. His doctor stopped the daily ibuprofen, adjusted his other medications, and 2 years later, his kidney numbers are stable. The taste, in his case, was not the problem. The taste was the smoke alarm. And he almost unplugged the alarm with a new mouthwash. So here is exactly what to do, in order, starting tomorrow morning. Step 1. Run the 2-minute source check I promised you. Before coffee, before toothpaste, go to your bathroom sink. Look at your tongue in the mirror under good light. A thick white coating that does not rinse away may suggest thrush, like Dolores, and that is a doctor visit. Then, rinse your mouth thoroughly with plain water, swish for 30 seconds, spit, and wait 10 minutes. If the taste washes away and stays away until the next morning, the source is likely local: your mouth, your saliva, your night. If the taste comes creeping back within those 10 minutes on a clean, rinsed mouth, the source is more likely systemic, meaning your medications or your body chemistry, because it is being resupplied from inside. Do this 3 mornings in a row and write down what happens each time. Those 3 lines of notes are worth more to your doctor than 10 minutes of vague description. Step 2. Put your medication list on the table, all of it, and I mean all of it. Prescriptions, over-the-counter pills, supplements, sleep aids, the ibuprofen in the glove compartment. Circle anything from the 4 categories we covered. Blood pressure medications, especially ACE inhibitors like lisinopril, enalapril, or captopril. Metformin. Any recent antibiotic, especially metronidazole or clarithromycin. And anything drying, water pills, bladder pills, older antidepressants, or any nighttime product containing diphenhydramine. Then, and this matters more than anything else I say today, do not stop any prescription on your own. Eleanor's lisinopril was protecting her heart the entire time it was annoying her tongue. Stopping a blood pressure medication abruptly can be far more dangerous than any taste. The circles are not a stop list. They are a conversation list. Step 3. Fix the overnight environment, because for many people this alone may solve it. Drink a full glass of water in the evening and keep water at the bedside. Brush and clean between your teeth before bed, and if you wear dentures, take them out and soak them overnight, every night. Finish eating at least 3 hours before you lie down, and if you suspect silent reflux, try raising the head of your bed a few inches with blocks under the frame, which lets gravity keep stomach contents where they belong. And now the habit I promised, the one that makes it worse. Alcohol-based mouthwash. Millions of seniors, waking with a bad taste, reach for the strongest, harshest mouthwash on the shelf, and many of the classic ones are more than 20% alcohol. Alcohol dries the mouth. A dry mouth makes the morning taste worse, so you use more mouthwash, which dries it further. If you use a rinse at all, the American Dental Association's guidance points toward alcohol-free versions, and your pharmacist can show you exactly which bottles those are. Step 4. Ask for the kidney check, especially if you are Raymond. If your 2-minute check points systemic, if your mouth is healthy but the metal keeps returning, ask your doctor for a basic blood panel that includes creatinine and your estimated filtration rate, the number that grades how well your kidneys are cleaning your blood. This is a routine, inexpensive blood draw, And if you take a blood pressure medication, Metformin, or regular anti-inflammatory pain relievers, many doctors will agree you are due for it anyway. You are not demanding anything exotic. You are asking for the single test that turns a vague morning complaint into an early catch. Raymond's stage 3 kidney disease was found by exactly this test, ordered because of exactly this symptom, and catching it early is what gave his doctor room to protect what function he had left. Step 5. Use the one word that changes the conversation. The medical term for a distorted sense of taste is dysgeusia. Say it with me. Dysgeusia. When you tell your doctor food tastes funny, you sound like small talk. When you say, "I believe I have morning dysgeusia, and I would like a medication review to look for the cause," you sound like a chart entry, and chart entries get investigated. Then ask your pharmacist, separately, for what is called a brown bag review, where you literally bring every pill bottle in your house in a bag, and they go through the list for interactions and side effects, including taste. Many pharmacies offer this at no charge, and pharmacists, as Eleanor and Frank both learned, are often the people who connect the taste to the pill in minutes, because medications are the entire center of their training. Before I close, one advanced piece that almost none of the coverage on this topic gets right. If you search your symptom online tonight, you will find page after page telling you to take zinc, because zinc deficiency genuinely can blunt and distort taste, and correcting a true deficiency genuinely can help. But here is what those pages leave out. The National Institutes of Health sets the safe upper limit for zinc at 40 milligrams a day for adults, and many drugstore zinc products, taken as directed, meet or pass that line. Taken for months on end, high-dose zinc can quietly strip your body of copper. And copper deficiency in older adults can cause anemia and nerve damage in the legs, problems considerably worse than the taste you started with. So the move is not to skip zinc and not to swallow it blindly. The move is to ask your doctor to check a zinc level first, one simple blood test, and supplement only if you are actually low, at a dose your doctor sets. If your level is normal, zinc tablets will not fix your mornings, and the answer lies back in steps 1 through 5. Treat the cause you have, not the cause the internet sells. So, if you take nothing else from the last 25 minutes, take this. A bitter or metallic taste that greets you morning after 60 is a message, not a nuisance. It cost Eleanor 14 pounds and a fractured wrist because nobody translated it. It cost Dolores 8 months of lunches with her friends, and for Raymond, it was the only warning his kidneys ever sent, and hearing it may have added healthy years to his life. The translation costs you 2 minutes at a bathroom sink, one honest medication list on the kitchen table, and one word, dysgeusia, spoken clearly at your next appointment. Every one of those is free, and every one of them is yours to do this week. Talk to your doctor before changing anything. Bring your notes, and do not let a 15-minute appointment rush you past a symptom you have been living with for months. You are allowed to say, "I am not done. I need you to hear this part." If this video made that taste make sense for the first time, hit the like button, because that is what tells this platform to show it to another 74-year-old who has been blaming her coffee for a year. Subscribe if you want more plain answers about the medications and the warning signs nobody explains after 60. And if you have a parent, a spouse, or a neighbor who has mentioned that funny taste even once, send them this video today, because they may be 3 mornings of notes away from an answer. Take care of yourself, and I will see you in the next one.